Post-traumatic stress disorder manifestation, treatment, and care. Situational events to trigger PTSD. Post-traumatic stress disorder is a trauma-related disorder many people suffer from regularly. The reason for this disorder affecting 1 in 14 adults is that PTSD can be caused by any terrifying event that a person experiences or witnesses. A person starts suffering from nightmares, flashbacks, and the inability to forget. Sometimes, it is possible to treat a patient with PTSD. Sometimes, it is hard to choose the most effective therapy. And sometimes, people just cannot develop a proper plan of care for such patients. The first thing that has to be done is the analysis of the situational events to trigger PTSD. Many people of different ages have witnessed or even experienced events that led to loss, frustration, fear, and so on. Post-traumatic stress disorder may be caused by a real or threatened death, sexual violence, injuries, natural disasters, or war. Any of these events cause an emotional breakdown as a result of which a human brain has to regulate many chemicals and hormones developed by stress. Not many people can cope with stress. They have to survive under the conditions they do not like. They try to make the solutions they do not want. Clinical manifestations of PTSD. Because PTSD is a frequent type of disorder due to the current natural, social, and even political troubles, it is very important to understand its clinical manifestations and know how to treat them properly. The experts have to catch the traumatic spark before it burns and emotionally scars. Post-traumatic stress disorder symptoms can be identified in 1 day, in 1 week, or even in several years after the event. Patients with PTSD may have intrusive memories in the form of nightmares, flashbacks, dreams, and unpredictable physical reactions to something that can remind them of the event. Other signs are sleeping disorders or disturbed sleep, anxiety or fear, appetite problems, depression, or spontaneous crying. All these symptoms may take place separately or in groups. Nurses and doctors have to define them in a short period and think about the possible treatment methods to help overcome the challenges of the disease. It is better to recognize the problems and solve them soon. As a rule, patients are offered to take tests and check their mental condition. They have to answer some questions, and nurses have to follow their reactions. Sometimes, it is hard to define the psychological problems of patients with PTSD. Still, tests and personal observations are usually the only available methods to analyze a patient who has survived an event that can lead to post-traumatic stress disorder. Treatment and therapies. The primary goal of any PTSD therapy and treatment is to help a patient gain control over life and understand the outcomes of all actions and decisions made. One of the primary treatments for a patient with any stage of PTSD is to pass through psychotherapy. Besides, doctors may prescribe some medications to facilitate the treatment process or make a patient more ready for recovery. Psychotherapy usually helps to understand the essence of life, choose the options available, learn how to cope with anxiety and depression, and avoid using drugs or alcohol. Therapies can be of different types. Cognitive therapies focus on thinking processes, and exposure therapies help to imagine events and survive them. Patients may pass through these therapies separately or combined. A patient may be treated in groups and discuss the problems aloud or choose private conversations to focus on personal problems only. Along with the therapies, it is possible to use some antidepressants like Prozac or Zoloft. Though this group of drugs helps to overcome depression and anxiety, it can influence the physical condition of a patient and cause some problems with sexual life. Some mood stabilizers can be also offered to patients. Usually, old people are eager to use this kind of medication. Of course, nowadays, people may get access to a variety of medications and therapies regarding their physical conditions, level of post-traumatic stress disorder, and intentions to survive the problems. Doctors have to make independent decisions relying on their professionalism and experience.